Penn Daly, Josh Romney, Don Sterling, and the volunteer students from the University of Utah and Brigham Young University. I'm sure we got off to a good start. We even have one, I think, from Utah State, so I think we're... UVU! I don't know.
By having lived here for 3 years and participated in the most extraordinary experience that anyone could ever have, and that was being part of the Salt Lake 2002 Winter Games. We had a life-changing experience by being here. It was such a wonderful blessing in our lives. I came actually quite ill. I was just diagnosed with multiple sclerosis just before we arrived in the December of that year, and Mitt came on in about February. And I was so sick and so frightened. By the time I left 3 years later, Mitt had chosen me as his hero to run the torch as it came into Salt Lake City. And it was with a lot of emotion and a lot of tears in our family's eyes as I was able to do that.
It has not been a good year for President Obama, and there's good news and bad news to that, obviously. The bad news is that we have 10% or nearly 10% unemployment, millions of Americans out of work. That's the bad news. The bad news is that North Korea continues along their course of nuclear folly, as does Iran, and no tough sanctions have been able to be put in place to dissuade or punish Iran for their extreme actions. There has been also bad news in that the president has not been able to pass various aspects of his agenda. It's amazing. How many months now? 15 months in, and he's still pushing his health care plan, which I think is ill-advised and has been rejected by the American people in every possible way they know how, including electing a Republican in Massachusetts. Were these normal times, I would probably relish the fact that the Democratic president has had such a difficult year, but these are not normal times. These are critical times for the country. I hope you recognize that. This is a turning point, I think, in a lot of respects for our country.
My name is Kevin Hargraves. I'm from Logan, Utah. With your recent election, Scott Brown, and other pickups in New Jersey, and also Virginia, what do you see the future of the Republican Party in the midterm elections and in the 2012?
You know what? I love what Yogi Berra said about forecasting. He said, I don't like to forecast, particularly if the future's involved. And so I can't be clairvoyant, but you have to recognize that there is a response in America to the misguided direction that they're seeing come from leadership in Washington. I was asked on The View the other day. That was a treat, by the way, being on The View and being interviewed by Barbara Walters. Not a lot of you get a chance to see that, but it was fun. Barbara Walters asked me, what are three, if you were president, or excuse me, if you were in charge, what are 3 things you'd like to see change in Washington? I said, that's simple. The president, the House, and the Senate. To healthcare, let me give you my quick thumbnail view on that topic, and I wrote a chapter on that. Getting everybody insured is not as hard as you might imagine. You might think, well, no, wait a second, that's got to be impossible. I'll tell you why it's not as hard as you might imagine, and that's because everybody in America already has health care. Not everybody is insured, but everybody has health care. What do I mean? Well, if someone, heaven forbid, doesn't have health insurance and they have a heart attack in their apartment, we don't just let them die. They get picked up by an EMS vehicle. You're paying for that. They get taken to the hospital, and if they need emergency surgery, they'll be given that surgery. You're paying for that. If they need drugs to get them back on track, they'll get them. You're paying for that. We are paying right now collectively as a society for those people who aren't insured. And so our idea was, let's use the money we're currently using to pay for people who aren't insured and instead use that money to help them buy insurance of their own that they can keep, so that we don't have to pay for them and they're helping to pay for themselves. And they can pay either the full amount of their premium if they can afford it, or they can pay some part of it. That's what we did in our state. It's working pretty well, not perfectly, but it's working pretty well. The bigger issue about how to get healthcare costs down for everybody, not just getting premiums down for individuals who were uninsured before. The bigger problem is, in my view, exactly what you said with that question. What do I mean by that? We have one part of our economy, 18%, that's not working real well. It's getting more and more expensive and out of reach for a lot of folks, healthcare. And so some folks look at that and say, okay, if it's not working, we've got to get government into it and have government run healthcare. And finally put in place price controls and cost controls and tell people who can get covered for what types of illnesses and so forth. In other words, have the government run it. And there are others like me who say that's exactly the wrong way to go. If we've got something in our economy, not working right, let's see if we can't get it to work more like a consumer-driven market. Let's see if we can't get healthcare to respond to the kind of consumer incentives that exist in everything else we buy. Because the things we buy, from our clothing to our cars to our homes, all those things become less and less expensive with better and better quality because of the dynamics of a free marketplace. And those dynamics do not exist in large measure in healthcare because the patient, the consumer, other than paying their deductible up front, has no stake in how much something's going to cost. Whether it's going to cost $5,000 or $50,000, they couldn't care because their insurance company's picking up the bill. Those incentives have to be adjusted. And by the way, the model for the nation is what's happening here in Utah with Intermountain Healthcare. There's some others like that. It's a model which is much lower cost than what's happening in the rest of the country, and it's found ways to create, if you will, consumer market incentives, new incentives in healthcare. That's the right answer. If you want to make healthcare work, make it less like a government-regulated utility, make it less like Fannie Mae, Freddie Mac, the post office, and Amtrak, and make it more like a consumer market. Thank you.
This is also about health care, and I'm wondering why, in the arguments against the Obama health care plan, no one ever accuses him of doing something that the government has no constitutional authority to do. It shouldn't be done on the federal level, it should be done on the state level. And we never hear that in the news.
I can't tell you why it's not in the news. I can tell you that there are conservative jurists, or excuse me, conservative attorneys who are speaking out on the constitutionality of the Obama health care plan. I don't know what the results will be. I'm not sure the plan will be passed. I hope it's not passed. If it is, I'm sure there will be an effort to test it constitutionally. There are those who, like myself, believe that getting people insured, helping the uninsured become insured, should not be decided by a one-size-fits-all federal plan, but instead states should be given the flexibility to use the funds they currently receive from the federal government to help get their own people insured. I think this should be a state issue. Look, the states were to be the laboratories of our democracy. Think about this. Can you imagine, in the largest and most powerful economy in the world, taking almost a fifth of it and having people in Washington, most of whom have never seen the inside of an operating room or have no experience in healthcare at all. They're going to come up with a whole plan, 2,000 pages worth. They're going to come up with this thing and impose it on the entire country. It's simply unimaginable. There's not a person in business who would do something of this nature. It's just, I mean, it's crazier than new Coke in the Edsel.